Today we're discussing intervertebral disc disease and I'm kind of excited about it. You'll see why in a second, but first I need a few very important things for this episode. Let's do this. So when you look at an x-ray of the spine, you very quickly notice a repeating pattern. You'll see a vertebra in an empty space, and then another vertebra, and then an empty space, and then another vertebra, and so on and so forth, all the way down the line. Now what you're actually seeing are the vertebral bodies, and that empty space in there is actually where the intervertebral discs live. You're not going to see the intervertebral discs on an x-ray because they're made up of soft tissue, and on x-rays you can only really see things like bone and metal and things like that. Those intervertebral discs play a very important part in the spine. They act as sort of like a cushion or a shock absorber. They accomplish this very important role because of the way they're made. Now, for the very scientific and important part. Imagine an intervertebral disc is made something like this wonderful, delicious jelly donut. I love science. Oh yeah. Oh yeah. Mm-hmm. The coffee has nothing to do with the spine. It's just necessary. I just ate my intervertebral disc. Don't worry, I have more. So the outside of this delicious intervertebral disc is made up of a tough fibrous material called the annulus fibrosus. And that surrounds and contains a softer, even more delicious inner jelly-like substance called the nucleus pulposus. In intervertebral disc disease, basically what happens is the annulus fibrosus begins to get a little bit weak in an area. And because these discs are under constant pressure when we walk and when we bend our spine, what starts to happen is that jelly-like center starts to find its way through the weaker portions of the annulus fibrosus. And what can happen is the disc can start to bulge, and it usually does that upwards towards the spinal cord. And in extreme cases, what can happen in a very quick traumatic event, it can squirt out really fast and press up on the spine. And this causes a bunch of neurologic problems, including things like extreme pain, something called ataxia, which basically means that you can't walk very well, and sometimes even paralysis. I do this for you guys because I care. The types of clinical signs and symptoms you're gonna see at home depends on exactly where the bulge or the rupture happens. The first signs and symptoms that you may see at home may be incredibly subtle. As your pet walks on the ground, you might just hear a little bit of a scuffing noise, almost like they're not picking their feet up quite as high as they used to, so every time they move forward, you can kind of hear their nails scraping on the ground. As it progresses, you may notice that they have some difficulty getting up, or when they do stand up, they might be a little bit wobbly, particularly in the hind end. You might notice some sudden bursts of what seems like extreme pain where they'll just suddenly cry for no reason. In extreme cases, you may notice a limp, or they might actually just not be able to get up at all, usually in their hind end, and a lot of times they'll just drag themselves with their front feet. This can come on really slowly, and it can come on extremely quickly. When we see a patient come in with these kinds of neurologic signs, the first thing that we do is a very thorough orthopedic exam. That means that we may test their reflexes from their head all the way down to their back toes. We also will press up and down the spinal column in order to see if we can find any painful spots. This tends to be a painful disease, and as you press right over where the lesion is, they usually react fairly painfully. Your veterinarian may also want to take some x-rays. Now, if you remember what I said before, intervertebral discs are not made of bone, so we shouldn't see them on an x-ray. But sometimes there are pathological changes to these intervertebral discs and they may calcify. And if that's the case, it may show up. But this isn't always the case. Sometimes we take an x-ray and they look perfectly fine. And that's because x-rays are not very good for evaluating soft tissue. Depending on the severity of your pet's clinical signs, your veterinarian may recommend that you go to see a specialist, particularly one that has access to something like an MRI. MRIs are the best modality for viewing soft tissues of the spinal column. It'll allow us to pinpoint exactly which intervertebral disc is affecting the spinal cord. Also, if there are no intervertebral disc lesions, it would allow us to evaluate to see if there are any other potential causes of your pet's clinical signs, such as a tumor that may be growing in the spinal column. Now, there are two basic ways to treat intervertebral disc disease, and that all depends on the clinical signs and how severe the problem is. In less severe cases in which the patient may be painful and can't walk very well but isn't completely paralyzed, sometimes we can treat with just conservative medical management. And that basically just means putting them on anti-inflammatory drugs and pain medication and resting them very, very, very strictly to see if the inflammation associated with the lesion goes down, and maybe they'll recover over a few weeks. In extreme cases, especially whenever they start losing neurologic function quickly, or if they're completely paralyzed, then surgery is going to be your best option. This is when an orthopedic surgeon goes in and finds the disc material that has bulged out or has herniated into the spinal cord and cleans it out in order to decompress the spinal cord. This also requires several weeks of recovery. And no matter which route you take, there's no guarantee that it's going to get 100% better or even better at all. There are a couple of things that you need to be prepared for when treating a pet with intervertebral disc disease as far as at-home care. You have to remember that in severe cases, they can't get around very well, which means that they're going to be lying down a lot, and they should be because that's part of their recovery process. So you need to be sure that they have enough padding whenever they're laying down so that they don't develop things like pressure sores. A lot of times too, depending on where the lesion is, they may have some difficulty urinating and defecating, which means that they may urinate or defecate on themselves, or in extreme cases, you may need to actually help them do this by pressing on their abdomen. So you have to make absolutely sure that they're clean at all times so they don't get things like urine scald. Also, if you live in a home with tile or hardwood floors, you may want to invest in something like cheap rugs to put all over the house so that as they recover, when they start walking around, they actually have some traction and don't wind up slipping and falling and hurting themselves more. So who's most at risk for this intervertebral disc disease? It's your overloved, super fat, long back dogs. So who's the poster child for this disease? That's going to be Aunt Ida's super fat dachshund who's wider than he is long. This also includes other breeds like hounds and any other breed that has a long back. I tell all of the owners of my patients that the best thing that they can do treatment-wise is to put them on a diet. They need to be thin. Otherwise, it's just going to make matters worse. Or they could recover and then re-injure themselves again, and next time they might be completely paralyzed. If you don't do proactive things like putting them on an appropriate diet and making sure that they maintain a healthy weight, and it does happen again, you're going to be torturing yourself every day wondering, if I had only maybe held back on the treats a little bit, would we not be in this situation? You may think they might love you less if you don't give them those extra treats, but I guarantee you, they'll love you just as much. And in the long run, you'll get to keep them happier and healthier for a longer period of time. At the end of the day, treatment can last for weeks to months, and sometimes they never get better. Sometimes we get to a point where we've offered everything that we can medically, and we just don't see much improvement. If that's the case, there are other potential routes of treatment. I'm talking about integrative medicine. And by integrative medicine, I mean things like cold lasers and acupuncture. I'm not saying that these are be-all, end-all treatments, and I'm not saying that these should be done by themselves. But I have seen some incredibly extreme cases in which we paired up good modern Western medicine with a little bit of traditional or integrative medicine, and the patient goes from being completely paralyzed to walking and even running after several months. Now, did that acupuncture or that cold laser actually do anything? Would they have gotten better if we had just done the regular medical routine and not done that? Maybe. But at the end of the day, the way I personally feel about it is, if it's available and has some documentable clinical evidence of possibly working in the past, why not give it a shot? So the things you should be taking away from this video is, number one, don't overfeed your pets. Don't give them so many treats that they wind up looking like an overstuffed sausage. You may feel like you're loving them more by doing this, but you're really hurting them in a lot of different ways. Number two, if your pet suddenly starts to look like they're having a little bit of trouble standing or walking in the hind end, even if it's just a little teeny tiny bit, like they might just be limping or just a little bit wobbly, take them into your veterinarian immediately, because the sooner that we can identify things like intervertebral disc disease, the better chances you have of your pet recovering. And number three, most importantly, anatomy is delicious. We'll see you guys next time. Don't forget to like, share, and subscribe. Bye now.